Infectious versus lifestyle diseases, causes, prevention, and key differences. Introduction. Most people know that specific factors may significantly increase or decrease the risk of various diseases. At the same time, not everyone considers that health conditions can be divided into infectious and non-infectious, and these two groups, in some cases, require varied prevention measures. In order to be mentally and physically healthy, it is vital to know how both types of conditions can be caused and what to do to avoid developing infectious and lifestyle diseases. Infectious diseases. In the beginning, it is essential to explore the first group of health states. According to researchers, infectious diseases are caused by pathogenic microorganisms such as bacteria, viruses, fungi, or parasites. Such conditions are transmitted from one individual to another because the listed microorganisms are contagious. In general, infectious diseases develop suddenly and have an acute form, but they can be resolved in less than a year. The recent COVID-19 pandemic demonstrated how infection conditions work and can affect numerous people once an individual becomes infected. Other examples of infections are chickenpox, measles, and influenza. Bacteria can cause conditions like tuberculosis, leprosy, syphilis, and others. Treatment options vary depending on the cause. Thus, bacterial infections are treated primarily with antibiotics, and antifungals work for fungal infections. Additionally, appropriate lifestyle changes can also contribute to the treatment of such health conditions. Lifestyle diseases. This group includes conditions that are not transmitted from one person to another but are developed due to other factors. As stated by Marx, lifestyle diseases include atherosclerosis, heart disease, and stroke, obesity and type 2 diabetes, and diseases associated with smoking and alcohol and drug abuse. In other words, these conditions are associated with how a person lives and whether they take care of their physical and mental state. If they do not, such illnesses can develop. Therefore, healthy habits and routines can help one avoid lifestyle diseases. However, if a person smokes, uses drugs, drinks alcohol, and engages in other harmful activities, the body suffers. Unhealthy habits can increase the risk of different mental conditions, including depression and anxiety. Prevention measures. The two identified types of diseases have some different and similar prevention measures. Thus, the key approach to avoid spreading infectious conditions is mass vaccination. If people are vaccinated, they can either avoid the virus or have a mild case. Further, infectious and lifestyle diseases can be prevented by increasing the population's health literacy. People should be aware of the primary factors that cause each type and do their best to decrease the risks. Research also shows that healthy habits, such as smoking cessation, regular exercising, healthy dieting, intake of vitamins, and other routine elements, lead to the prevention of both types of conditions. People with strong immune systems can get mild forms of infectious diseases or avoid them. Additionally, all the listed factors reduce the risks of obesity, strokes, and other lifestyle conditions. Conclusion. To conclude, one may say that it is essential to know the difference between infectious and non-infectious conditions to treat and prevent them correctly. For example, when one knows that their friend or relative is currently sick, personal contact needs to be reduced if the disease is contagious. However, if it is a lifestyle condition, then there is no need to avoid interaction. While some prevention factors for these two disease groups, including healthy dieting, match, others are different.